The growing scientific evidence for masks to fight COVID-19 explained. It's true, the evidence for masks was weak before, but that's changed because we changed the science. Isn't that convenient? But they really haven't. And if you actually read the article, and this video very well may be taken down, I'm going to just review some of the researches they've talked. A review of the research here in the Lancet concluded that for the general public, face masks are associated with protection. That's just a sentence. It doesn't mean anything. Even in non-healthcare settings. Well, of course, face masks are all associated with the protection from inhaling bugs and other things, but they don't say COVID-19 here. In fact, what they do say is that, among other measures, and caution that masks alone do not fully supplant the benefits of other precautions. So the first study doesn't even say that masks help with COVID-19. It says that face masks are associated with protection. From what? Now, the second one, let's go there. An International Journal of Nursing found that community masks used by well people could be beneficial. Could be. They said it could be, particularly for COVID-19. Although it is unclear how much of this benefit comes from masks. Oh my God! Awesome study. Now, let's look at the next study. A Health Affairs found state mandates to wear masks. That's what's happening everywhere across the country. Help reduce the spread of coronavirus. Though they caution that this was merely an approximation and may not actually be true. So this is the paper you're reading. The growing scientific evidence for masks. There is none. The science is conclusive, however. Masks and respirators do not prevent the transmission of viruses. And we know this from hundreds of peer-reviewed papers over the decades that claim that. Not a single one claims otherwise. Are face masks effective against COVID-19? No. They're effective against you maybe spewing your disease on someone, but if you're sick, you should stay home, you idiot. The sick, the predisposed, and the elderly should be protected. The general public should never wear a face mask. And let me tell you why. Effectiveness of masks and respirators against respiratory infection in healthcare workers specifically. This was the systematic review on all the data that exists, and it happened back in December of 2017. And the only thing it concludes that if you wear an N95 mask, and not the kind with a vent to allow you to breathe out, you may have a 7% increase in protectivity. 7%. That doesn't include a surgical mask. That does not include any cotton face covering that you want to sew together or any other piece of nonsense that they're claiming that you need to wear. Those things, there is no evidence to provide that they do anything except make you look like a puppet, a slave. If you look into all the scientific data, unless everyone's wearing an N95 mask, and even if you are wearing an N95, there's only potentially, it's not proven, a 7% reduction in transmission. 7% if you wear N95 or higher. The rest, 0%. And yet, I had a video up yesterday from a wonderful doctor from my home state, Dr. Kelly Victory, just north of us. She's peer-reviewed, board-certified, trauma and emergency specialist, decades of experience, respected in her field, and she says the same thing that I just said. Yet the moment it premiered, now let me give you this preface, it was up all day and monetized, waiting for the premiere. The moment it premiered, 5 seconds in, it was removed. Now, we didn't get a strike. They just censored us. And that's why there's no strike involved. Because there's no penalty if they're just censoring. I didn't do anything wrong. They just don't want you to hear her information, which I put up on DTube earlier today.
Hi, my name is Dr. Kelly Victory. I'm a trauma and emergency physician with a specialty in disaster preparedness and response and the management of mass casualty.
And I think you should go over there to DTube and check out what Dr. Victory has to say, because she's been in the field for decades. I haven't. I've just done more research than most people in decades on esoteric topics, specifically on face masks. Now, the corporations like Facebook and YouTube that are censoring this information are out of bounds. Now, albeit they are companies and they can do whatever they want. But if they claim to be fair and balanced or open and they support the First Amendment, that could not be further from the truth, because the actual scientific data is being prevented from getting out there almost for the last decade on many topics, including COVID-19, respiratory illness, the use of masks, even climate change. You know what I'm talking about. Share this video with like-minded people. Share the video on DTube that was banned from YouTube with Dr. Kelly Victory. And share the facts if you care about them. Face masks are effective in promoting panic and controlling the public, period. And I think we've explained it quite well. Let me just go over some of the new breakthroughs in science. The research is in. Among other measures, caution that masks do not supplant the benefits of other precautions. That means wash your hands and stay away from sick people. The next paper, it is unclear how much benefit from masks in protecting the wearer. The next study, though they caution that this was merely an approximation and sensitive to methodological changes. That means it's fake. They use math to trick you, and on and on. I don't know where I need to go from here. The proof is that face masks are effective in preventing you from inhaling pollen and construction dust. The spreading of respiratory disease, however, there is a mountain of evidence in the other direction. Proper prior planning prevents piss poor performance, as the mainstream media and other corporations are censoring everyone. They are preventing you from getting actual information from actual doctors. Please watch this 17-minute expose on the facts.
For the past 2 decades, I've been in public health, working with and advising Fortune 500 companies, hospitals, schools, and municipalities, developing plans and training them to respond effectively to the worst ever cases, whether that...
This woman worked for Health and Human Services and even, I think, the CDC or the WHO. And yet, YouTube blocked her because she's saying that these mandates on face masks are ridiculous. Share this with like-minded people. Watch the DTube video. Share it on your social media. And get to the facts. Because that's what's needed right now. Be safe. We love you.